Good day, and welcome to our webinar on exercise and depression. Using exercise to motivate and empower clients who suffer from depression, presented by Derek Archer. Depression, the most commonly diagnosed and most severe form, is called a major depressive episode. According to the DSM-4, the criteria are as follows: an extremely depressed mood state that lasts at least 2 weeks, cognitive symptoms that include feelings of worthlessness and inability to make decisions, suicidal thoughts, disturbed physical functions like loss of appetite, disrupted sleep, insomnia, fluctuations in body mass, loss of energy. Normal activity is very challenging. The sum total of these disturbed functions can result in a very weakened immune system. There's loss of interest in pleasurable things, and untreated can last around 9 months. Now, of those factors in terms of physical functions, remember that most of our body's recovery occurs while we're sleeping. So as soon as we have disrupted sleep, the likelihood of our nervous system recovering or remaining normal is very small. And the insomnia can either be difficulty falling asleep or early morning insomnia, where the person wakes up at about 2 o'clock or 3 o'clock in the morning and battles to get back to sleep. There is a very close link between depression and anxiety. Both are prevalent non-communicable diseases, non-communicable states or conditions that people suffer from in the world today. If you look at the symptoms of depression, as we mentioned before: frustration, sadness, worthlessness, irritability, loss of interest in normal activities, thoughts of suicide or death, tiredness, disturbance in sleep or appetite. If we look at anxiety, here we see a heightened state, sympathetic nervous system response, says trembling, an increased breathing rate, feeling nervous or powerless, having a sense of impending danger or panic, high heart rates, we get tachycardia, sweating. There's a common area between the two of them. We have restlessness, trouble thinking, concentrating, or making decisions, or suffer from excessive worrying. There are unexplained physical complaints such as headaches or stomach aches, agitation. The physical symptoms like headaches and stomach aches are often ignored as we so busy with our everyday lives are trying to deal with issues that we sort of ignore those as being a stomach cramp here and there, or headache, just take a headache tablet, not realizing that they're a symptom of something much greater. In terms of mental health, there's another condition called dysthymia, which is a persistent depressed mood that continues for at least 2 years, and the person is never symptom-free for more than 2 months. Symptoms are the same, but not as severe and fewer in number as compared to a major depressive episode. However, these can occur concurrently. So someone can have dysthymia, and then the depression deepens to become a major depressive episode, and then they come out of that major depressive episode, but still remain in a dysthymic state, suffer from dysthymia. Some facts about depression: 60% of suicides are linked to depression. 1 in 6 South Africans suffer from depression, anxiety, or substance abuse. Often the substance abuse goes hand in hand with that altered mood state, either the cause of or is used to self-medicate. Globally, an estimated 350 million people of all ages suffer from depression. Those are the ones that are diagnosed. We're not sure. That is according to the American College of Sports Medicine. However, the World Health Organization has the figure under 300 million, but at the end of the day, those numbers are unacceptable. They show a rapid increase in people suffering from depression, and it is now still one of the foremost non-communicable diseases, fastest growing non-communicable diseases globally. It is the leading cause of disability worldwide, and is a major contributor to the overall global burden of disease. You can imagine the cost to economies based on people not being able to work, having sick leave, not being able to work efficiently, and of course, cost medication and treatment wise. More women are affected by depression than men, often with the way they are treated, a lack of equal rights, abuse, spousal abuse, being seen as less than in a normal society. Some other facts, things to think about, especially as we're heading into winter, being May in 2020, the decreased sun exposure has been linked to a drop in serotonin levels. We have SAD there at the end, meaning seasonal affective disorder. As one is exposed less and less to sunlight, so your levels of serotonin decrease. What's also quite interesting to note is that our mechanisms, or our protective mechanisms against sunburn and skin cancer, involve covering ourselves up quite with either clothing or very strong sun factor creams to protect us. However, they've also been linked now, because we're not getting as much exposure to the sun because of these protective mechanisms, has resulted in low serotonin levels and depression. Treatment. As with many non-communicable diseases, a multifaceted approach is best. Cognitive behavioral therapy, where people learn how to manage their conditions, how to manage their lifestyles, how to manage their stress. Good nutrition. Nutrition is vital. We know if those suffering from poor nutrition have physical and cognitive and depressive symptoms. Avoiding alcohol and non-medical drugs. Alcohol is a depressant in most cases, and non-medical drugs, recreational drugs, we're not sure. All of our brain chemistry differs slightly. So a drug that one might take recreationally, your response may be very different to what happens to somebody else. And unfortunately, brain chemicals, once they are thrown into disarray, can result in the situation being even worse. So trying to escape the situation, self-medication more often makes the situation much worse. Medication. The treatments that we use for treating depression, we use medications that are divided into categories or different classes. We have antidepressants themselves and mood stabilizers. Your mood stabilizer drugs, we'll talk about shortly. In terms of antidepressants, there are different classifications based on their actions and their areas they target in the brain. First one being the selective serotonin reuptake inhibitors, SSRIs. These are possibly the oldest antidepressants to be developed. Prozac, Cipramil, Zoloft. Prozac was one of the first that had some quite horrendous side effects. Cipramil seems to be the one that is given out quite regularly by GPs and so on, because it is very light acting, as well as Zoloft. Now, as with any medication, there have to be stringent checks to make sure that if there are side effects, as the ones listed below, none of them are excessively dangerous. And obviously, they go through a whole lot of testing. However, in all those tests, they need to list every possible change to that individual that is participating in the test, those that are taking the actual drug and not the placebo, or those in a control. So some of the side effects include nausea, insomnia, dizziness, weight gain or loss. Obviously, as fitness professionals, that's something we should always take note of. Tremors, sweating, anxiety and restlessness, decreased sex drive, drowsiness or fatigue, dry mouth, diarrhea, constipation, and headaches. Unfortunately, some of those symptoms are the ones that we indicated before as being symptoms of depression. We always need to keep alert to these changes. Then we have atypical antidepressants. One we've listed here is Wellbutrin, which works on the serotonin and some other neurotransmitters. Wellbutrin is actually utilized in the form or under the brand name Zyban before as an anti-smoking drug. Unfortunately, as with any antidepressant, it's not one match for everybody, so everyone responds differently. And some of the people that were on the Wellbutrin, or the Zyban, should we say, for helping them or assisting them wean themselves off cigarettes, had some really hectic psychotic episodes on stuff. Side effects here include nausea, insomnia, dizziness, weight gain again, sweating, anxiety and restlessness, drowsiness and fatigue, and dry mouth. We move on to tricyclic antidepressants. Amitriptyline works on serotonin and norepinephrine reuptake inhibition, as well as dopamine. One of the typical drugs here is Effexor as well. Effexor works on both the serotonin and norepinephrine reuptake inhibitors. The side effects associated with tricyclics are weight gain, loss of sex drive, dizziness, nausea, dry mouth, blurred vision, constipation, difficulty urinating, sun sensitivity, something we need to think about should we be training clients outside, increased heart rate, one thing we need to take account of there as well as exercise professionals. disorientation, or confusion. Mood stabilizers. Sometimes additional medication is prescribed to assist people suffering from depression. These may have their own side effects and should be investigated as well. Some of the mood stabilizers, you'll see the one bottom right picture, lithium carbonate. So lithium is used was used quite extensively as a mood stabilizer and to help treat people suffering from bipolar disorder. Now remember, the mood stabilizers, not everyone is going to be put on them. Depends on the type of depression they have, their symptoms, and so on. So everyone, once again, just as we treat people as individuals with training and with our exercise prescription, so psychiatrists will be treating people as individuals as well. And it's never an exact science because of that specificity to the individual. What's important for us as trainers is to be aware of what these drugs do. So you have besides the online options, we have WebMed. There are a couple of other medical or pharmaceutical websites to go to, but your pharmacist down at your local pharmacy, they're the very best people to ask about these drugs. They generally give you a good breakdown, and because they see people all the time on it, they're able to give you an idea of what sort of side effects there are. And should you pull out an insert or a client comes to you with specific symptoms or a specific concern, you're always able to ask them. The other option is to pick up a MIMS. MIMS is like an encyclopedia of all of the medication on the market at the moment, basically sorted into areas like your cardiovascular drugs, drugs for the respiratory system, endocrinology drugs, and of course, psychiatric drugs. Those will also list all the side effects, as well as how the drugs work in the body and so on. At the end of the day, it's just allow us to be informed. We are not medical practitioners, so we are not able to, we shouldn't be recommending any change of medication to any of our clients, as that is well out of our scope of practice. And any changes should only be made by those medical professionals that they are dealing with, either their psychiatrist or their GP. Now, quality of life and risk of mortality. Long-term depression can decrease functional ability and increase mortality. It has an impact on self-esteem, motivation, relationships, and the ability to function in everyday life. Also on one's self-perception. So how do we perceive ourselves? Are we worthless? Do we have a value? What's our self-efficacy? Can we actually do the things we think we can do? Am I able to do what that person is doing? So how we perceive ourselves, and obviously those have huge filters on there based on us suffering from depression. Stress management and good physical health are associated with good mental health. The resilience of the client may also help to determine the person's level of mental health. People are different. Some people have very strong characters and are able to withstand different stress levels, higher stress levels than others. It does not mean that person who is suffering is weak. It just means that everybody's tolerance to stress is different. There's also a bidirectional link between the immune system and mental health. There is still some research going on about how a suppressed or inefficient immune system can result in mental health issues and vice versa. We tend to understand the aspect from the vice versa position, where if you are not physically well, it will collapse your immune system. Same thing with mental health, because of all the other things, the loss of activity or lack of activity, poor diets, nutrition, poor sleep, that will result in a weakened immune system. Interestingly enough, there is also a very strong relationship between depression and diabetes, particularly diabetes, adult onset diabetes or type 2. So depression, you have change in appetite, suicidal thoughts, nervousness and anxiety, loss of energy, high levels of cortisol, which impairs insulin sensitivity, abnormal levels of norepinephrine and serotonin, so your body is in a heightened state all the time. With diabetes, as soon as someone has been diagnosed as having diabetes, the stress of daily diabetes management, primarily daily difficulty of keeping blood sugar under control, is a major cause of stress for these individuals. Occasional tension between patient and the doctor, fatigue and exhaustion exercising, difficulty making dietary changes. So type 2 diabetes, as a result, it requires, in order to be managed, a massive change in lifestyle. as well as taking new drugs. It can be an additional stress and be along with other comorbidities where that person perhaps is unable to cope with the changes and results in a person falling into a depressive state. Some precautions. We need to be very careful how we approach a client we believe has mental issues. Now, we need to define here what we mean by mental issue. We have screening forms that we hand out to new clients for them to complete, and those are generally to establish risk, and predominantly cardiovascular risk. However, if someone through their screening has identified that they're on particular medications, we may then pick up that the person may suffer from depression and the like. Once again, we're always going to check up on what the medication does, just to make sure we do not ever put that person at risk or put them in danger. If it's a particular cardiovascular drug, for instance, or cholesterol drugs, it may result in tendinitis, any of those kind of things. But if we do pick up that someone does have an issue, we have to be very careful about the way we address them. Also be aware of substance abuse signs, which are common in people suffering from mental illness. Like I said before, the chance of someone self-medicating is quite high. And we need to make sure that if they are self-medicating, that they don't rock up at a training session, either under the influence of drugs or alcohol, because once again, that'll put them in danger. And at the end of the day, we know that self-medication is not the best way to go. And at the end of the day, if someone is taking their health responsibly, like by coming to a trainer and so on, that's one of the things they really need to work on. And that's why we have the cognitive behavioral therapy element to treatment of depression. Know positive coping skills and identify those without them, and without at a greater risk of depression. Never be afraid to refer to someone to a healthcare professional, keeping in mind the stigma attached to the condition. People tend to not understand depression, so when someone is suffering from depression, the most common thing is to pull yourself together, you'll be fine, you're overreacting and so on. Understanding that when someone is in a very deep state of depression, they are unable, without the use of medication or without the correct treatment, to bring themselves out of that. They are mentally incapable of doing so. And when there are chemical changes in the brain, the medical approach, or the approach, needs to be a combined approach via the all the different medical professionals, be the psychologists and psychiatrists, to try and assist that person, bringing them up to a cognitive state where they're able to go through therapy, to adopt new lifestyle management skills, and that sort of thing. But up until that point, that person is not going to be able to make the changes themselves. They need assistance with that. Some safety considerations as well. Like we said before, be careful if someone is using drugs or alcohol to self-medicate. Make sure you monitor their overloads. When we're training across all the components, do not put the person under too much stress. Okay, we need to be very careful. Yes, as you'll see later on, our prescription is based on that of a healthy adult. However, their mental state possibly will not allow them, or not at least allow them to enjoy a very intense session. They'll not be comfortable doing it. They will struggle through it. They don't have the motivation as it is. So to put the overload or to increase overload too much, you may put the person off training as well. Also educate the clients. They know to follow your guidance, not to push too hard. And establish realistic goals. People need to realize that, well, we need to realize as trainers, firstly, that we need to make sure that the stress you put the person under, the physical stress, controlled as it is with a normal person. But at the same time, remembering, of course, that any of our loading has to be done based on the response we see. So there is a statement that American College of Sports Medicine have in there, on some of their research documents, that says that pain is not the friend of someone that is depressed. So we don't want to put them in a situation where they're really uncomfortable and sore. They won't come back to gym. We're trying to bring about changes that make them feel good. And if they feel good, their likelihood of maintaining their training program and their routine is much greater. Some considerations from a medication perspective. Antidepressants may cause drowsiness and loss of coordination, which needs to be taken into account when we are designing training programs. Not so much the drowsiness, perhaps, maybe the loss of coordination. So We need to be careful when we're doing exercises for proprioception, although they're probably of huge value here, that if that person has poor coordination, we make sure that they don't hurt themselves. Generally, as a rule, most of the antidepressants don't affect medication. The medication doesn't affect heart rate, although it's always good to check. Sometimes, in addition to, as we said, the mood stabilizers and so on, people are given altroxin, which is a thyroid hormone, to help augment or speed up the effects of the antidepressants. You know that once we start adjusting thyroid levels or thyroxine levels, there may be a change in sympathetic nervous system response and in heart rate as a result. Our main thing with training clients here is possibly their weight gain. Side effect number one, almost call it the public enemy number one in this case, apart from the mood states. According to WebMD or WebMed, as many as 25% of patients gain weight from using these medicines. There are a number of reasons for this, although they couldn't pinpoint one exact reason, and sometimes, as much as we want to blame the drugs, maybe not. So medicines may affect both appetite and metabolism. One line of thinking is that people take pleasure in eating again and may overeat as a result. So someone that is in a depressed state, that hasn't eaten properly for ages, suddenly starts to enjoy food again, and they're doing it so much that they don't really monitor the size of their portions and how much food they're actually eating. It does seem to get worse the longer people are on medication. So as trainers, what are we going to do about this? Firstly, it is important to work within our scope of practice. Extremely important. Like I said a couple of slides back, it is not in our scope of practice to address medication issues. Okay, so we don't tell someone to change their dosage or stop that medication or whatever. Any concerns we may have, we've asked the client to bring up with their doctor and see if there's an alternative perhaps, or what the doctor recommends. But other than that, we stick within our scope. And our prescription, if we follow the American College of Sports Medicine guidelines for a healthy adult, the prescription will be pretty accurate. If necessary, it might be a good thing to refer to a dietitian. And like I said again, if that person's appetite has been suppressed purely by the depression, or they're not interested in eating, the dietitian would be a good way to help the person recommend some variety of foods, variety in their diet. As they start feeling the need to eat again, they eat healthy and choose the healthy options. And once again, never tell a client to stop medication. The doctor will decide on appropriate action. Other factors that may make training a really positive experience. You know what? We are privileged. This is obviously, we are based in South Africa, Johannesburg, and in this environment, we have really awesome weather. So if we're able to take clients outdoors into the sun, so much better. So much the better for them. Exposure to the sun, if someone's inside or indoors all the time, they need that dose of sun. They need the serotonin increase from being exposed to the sun. They need the vitamin D. The other option to think about is some sort of group training. Some people, the one-on-one, they don't really want, they're a bit afraid, they would be up close and personal with the trainer, but then bring in a group environment, then they know they're getting the attention of the trainer, but maybe not so much attention. And there's also the social aspect that comes in as well. And as they feel more comfortable, often people that are depressed withdraw, and their social into their life and their interaction with people is reduced. This may give people an opportunity to start interacting, build up that social element of the life, to belong to something. So if you have a group of people, 4 or 5, doesn't have to be a massive group of people that meet 2 or 3 times a week, and they are your 8 a.m. class, and they start to see each other as being part of a particular group and belong to that group. They have a routine. After the training session, they'll go and have a coffee or whatever, post-workout protein shake at the local juice bar. But that begins to become an identity for them as well, and really positive. Something else we need to do as trainers is look at opportunities to give positive feedback. And it doesn't have to be, the one thing you don't want to do is to make it sound like you're just saying it for no reason. At the end of the day, we're trying to build someone up. So if we do notice small things like changes in posture, changes in weight, just changes in the way someone does a push-up, for instance. Their technique has improved, their strength, their stability. Those kind of things are a great way to improve their self-esteem and their self-efficacy. And we also know, interestingly enough, that someone that is depressed, we can see straight away the shoulders move to an anterior position, their body collapses in on itself like it's trying to protect itself. But we know that if we train them, we improve their posture, get them to open up their chest, pull their shoulders back, it has a psychosomatic effect as well. It's also important to teach clients how to track their workouts so they can start monitoring improvements for themselves. Give them some goals that they can see. This is a generation that is data intensive, and we have lots of apps that we have at our disposal that allow people to monitor things like their step counts, their calories for the day, their moves. If you look at the Technogym system, they talk about moves as opposed to steps, and use these as ways to motivate, and also for us as trainers to track them when they're not with us, and make people accountable as well. And once again, pain is not the friend of people suffering from depression. So going out there to destroy their client physically is the worst possible thing to do. The components of an exercise training session: as per normal, you'll warm up for 5 to 10 minutes of light to moderate intensity, cardiorespiratory and muscle endurance exercises. This would also include your ramp sessions, so your mobility, your prehab if necessary. Then your conditioning: at least 20 to 60 minutes of aerobic, resistance, neuromotor, and/or sporting activities. Exercise bouts of 10 minutes are acceptable if the individual accumulates at least 20 to 60 minutes of daily aerobic exercise. So what that means is, if that person isn't really able to train in a formal setup, if they're able to get up and move around for 10 minutes, they're going to do the flight of stairs for 10 minutes, or walk around the office park and the parking lot for 10 minutes at a time, the effects on the body are cumulative. And that is to maintain health status. If someone wants to start improving their fitness, then obviously we need to start adjusting frequency, intensity, and duration. There should be, if we are setting up a formal session with that person, there should be a proper cool down, at least 5 to 10 minutes of light to moderate intensity cardiorespiratory training and muscle endurance activities, again, just to lower the levels of lactate for one thing, restore, use it as part of active recovery, and some stretching to cool down as well. So here we could use your static stretching. We may use flex bands to help the person with their own stretching, or we may, as trainers, if they're comfortable having us in their space, we may stretch them ourselves. The stretching is also a great opportunity, or the end of the session is a great opportunity to take the chance to acknowledge improvements in that person's performance, build them up a little bit, so when they leave, they feel really good. And at FitPro, we have a policy or a belief that if the minimum requirement from any training session is that person walks in feeling better, walks out better than when they walk in. So if they walk out of there and they're really happy, and before when they walked in, they're not in a great mood, by being happy, we are reinforcing that activity and reinforcing a behavior. So the likelihood of them being consistent in their training is so much greater. Please make sure of this. We even use it we recommend it for guys that are graduating with us just as normal trainers, but also those guys that are out in the market already with diverse clients, bodies, client lists. Now we still got to focus on this. We are in a very stressful environment based on activities, global activities, economies, that kind of stuff, work. And if we can keep people active and we can keep them feeling good, we're doing our job really well. Thank you for joining us.